right, welcome back once again. Our friends from Vibra Hospital are here to tell us about the unique services they provide for patients in the Low Country. We've got Melanie Floyd along with Diane McNeil. Thank you all for joining us. A very unique hospital here in the Low Country. Not a hospital you would go to immediately, but sort of an intern, more like a buffer in between maybe going home and leaving the hospital. You're quite not ready to go home yet,
right.
But the hospital is you've stayed there sometimes much too long or longer than what your insurance will take care of. Tell us about what Vibra Hospitals is all about.
Absolutely. We complement the local hospitals. We get most of our patients from the hospitals. They've had their stay at the hospitals. It's time to discharge, but they still need a little more care, so they come to Vibra. We are long-term acute care. We average about 25 days in the LTAC side, the long-term acute care side, and we also have a TCU side, which is more of a skilled side, another step down. So we get patients from other hospitals, and then they come to us for a relatively short period of time, you know, less than a month.
Tell us about what is long-term acute care. What exactly is that?
So I can speak to that. So long-term acute care is the opposite of what short-term acute care is.
Okay.
That's basically what the hospitals in the area are. They're short-term acute care. So when patients like our specialty, vents and wounds, have an extension of care or need an extension of care, they come to us.
Okay.
Yeah.
When the patients come in, they're usually referred by the hospital that they were coming out of, right?
That's correct.
Instead of going directly home, because sometimes when they go directly home, the person who's going to be there with them is not that skilled as a caregiver,
Right.
which is extremely important for
Right.
what you folks do.
Right.
Most of the people we deal with are the case managers and physicians at the local hospitals, and they're referring to us. And it's our job to get them back to the hospital community, and meaning the physician that they came from, the assisted living that they were with, we want to get them back to where they were before they went into the short-term acute care hospital.
Again, right now you're taking in about 24 to 25 other patients that come in for an extended period of time. What sort of patients are you getting in right now?
So, so we get a lot of patients that have been on ventilators in the short-term acute care hospitals that are unable to get off the vent in the 3 days that is allotted to them. So in the event that you if you can't get off in that 3-day period and you have to stay on longer, that's a process, and we handle that process. We specialize in that process, and actually we do so well with the vent patients. We have, you know, most people in the healthcare organizations know that not having ventilator associated events in 2 years, that's big. That's big. So that speaks to our respiratory staff. We also specialize in wound care, and our wound care rates are really great. They're like very comparable to the nation's, and so that speaks to the nursing staff. So yeah, that's what we do.
So with you've got wounds, possibly burn patients as well. Do y'all bring those in? I know that there used to be a burn unit at the Medical University, but the main one now is in Augusta. Do y'all have sort of interim care between where would they be at Augusta and then possibly coming home? Do y'all see many
Possibly.
of those?
We don't see many burn patients, but it's having a burn as a wound, so you know, we can definitely handle that before we can transfer them to another facility if need be.
And the wounds that y'all see in the patients, sometimes older patients where the wound is not healing as fast as it should be,
or might need a
much younger
might need a wound vac or something where their family members might not be able to take care of it as much.
Sure, because cleaning wounds on a day-to-day basis, some people they just can't stomach it. But it has to be done. It has to be done by someone who is qualified, a nurse, a technician that is qualified. Speaking of nurses, you're hiring some nurses right now. Tell us about that.
We are. So in Vibra Hospital, we see so many different things, and in short-term acute care hospitals, nurses get used to kind of taking care of the same patients for just 3 days. We see so many different things here at Vibra Hospital. It's a great opportunity for any nurse to, you know, challenge herself and get those skills up.
Are y'all the only folks located in the Low Country, located in the state?
We are not the only ones in the state. The next closest facilities are 2 hours away. So we do serve this region. We do serve the entire state. We recently have taken patients from Johns Hopkins, Duke, so we get them from all over. And a lot of times it's a family decision because there's family members here.
And one of the most important things, where are you folks located?
We are in the old East Cooper building.
Down right off of Bowman Road.
Right
That's
off Bowman
correct.
Road.
Thank you both so much for being
Thank
here.
you.
All right, thanks for
Thank
having
you.
us.
We've got more Low Country Live coming up in just a moment, so stay with us.